So I'm starting your timer and here is your question. Right, so if you have read and understood considering its surgical anatomy station, kindly please tell me if you can identify which region is this that you're looking at in picture A or on the right hand side.
On the right hand
Or,
side.
or if you can look at this picture A,
It, yes, it is a sartorius.
all right, this muscle is sartorius. But
Yes,
if I asked you to identify this region that you're
this region
looking at,
is an inguinal region.
inguinal region or the femoral triangle, it is also called. Can you tell
Yes,
me how is it formed? What are the boundaries of this region?
the boundaries of the femoral triangle.
Yes, please.
Okay. The femoral triangle is made. I will come to this later.
Okay. Can you please tell me the contents or the chambers present in the femoral triangle?
The femoral triangle contains the femoral sheath, and it
Yes.
contains the musculosa. Sorry, it contains the femoral sheath, and the femoral sheath contains the femoral canal from the medial side, together with the femoral artery in the next to it, and the femoral nerve on laterally,
Okay.
and this is the third compartment of the femoral sheath, and also it contains the lateral cutaneous nerve of the thigh, together uh, with with femoral branch of femorogenital nerve.
Okay. What is the superior boundary of the femoral triangle?
It is the inguinal ligament.
Very good. What are the attachments of inguinal ligament, please?
Anterior superior iliac spine and the pubic tubercle.
Very good. Okay. And this is how the inguinal ligament is formed.
How it is formed?
How is it formed? Yes.
Inguinal ligament, it's formed by the uh, uh, it is formed by the thickening of the aponeurosis of the
Which muscle?
abdominal muscles, which is external oblique muscle, internal oblique muscle, and the transverse abdominis muscles.
Okay. The most medial chamber or the most medial, you said, is the femoral canal. Can you
Yes.
tell me the boundaries of the femoral canal?
Okay, the femoral canal is bounded medially by the lacunar ligament, and then it is bounded laterally by the by the septum, which is to separates it from the femoral
Then,
vein,
good.
and then anteriorly from the inguinal ligament, and posteriorly um,
Pectineal ligament. Okay. Can
pectineal
you
ligament.
please,
Yes, and also I remembered the boundaries of the femoral triangle,
yes, now you
which
remember.
is superior is inguinal ligament,
Yes.
and laterally is the sartorius, and medially is the adductor longus. And the roof will be skin, subcutaneous fascia, and deep fascia.
Okay, and laterally is iliac ascensors. Rufus. All right. Okay. Can you please tell me what is the purpose of this femoral canal? One pathological and one physiological purpose.
Okay, femoral canal physiological function. It is a potential space which allows
Good.
the expansion of the femoral vein while increasing the intra-abdominal pressure or while increase the venous return from the lower limb. So it expands, so the femoral nerve expands and find a space for this expansion to prevent congestion. And one of the the pathological cause of it is femoral hernia.
Yes, potential space for hernia. Okay. What are vascular lacunae and where are they located?
Okay, vascular lacunae is located in the medial aspect of the it is a medial compartment of the thigh, and it present in the medial aspect of the thigh and the
Medial, or you can say behind and below the inguinal ligament. And
yes,
then
yes.
you can, yes, all right, they are medial and lateral. All right, okay. If we can ask more, you told me from medial to lateral contents as well, boundaries as well. If you can please here, if we can identify certain structures. You have already identified sartorius.
Sartorius. Yes.
Yes, if you can please identify number 6 over here.
Yes, it
Which
is.
vessel?
Yes, it is the femur. It is the femoral vein.
All right. If you can identify this one. Was it vein? Because you have to consider. Uh, look at the color. Okay, what is 8?
It is the femoral.
This is
It is the
vein and
femoral
this is
vein. Yes, it
artery.
is artery.
And
Yes, yes, yes,
7 is nerve. Okay.
yes.
So which muscle would that be? 10.
10.
See, so now you have to imagine the floor of the femoral triangle. So
The
what is the most
iliopsoas.
floor? So it's then what is 1? 1 and 2. Which one are 1 and 2? What is 10, please?
10 is the adductor longus. Is the adductor longus.
Adductor longus is the medial. Okay. So iliacus and sos, what you were saying, it's the lateral. So that was right.
Yes.
And then 1 and
But
2 would be
in
pectineus
in this
and
picture,
adductor longus.
in this
Pectineus.
picture, the medial is the 1 and 2.
Yes. And the lateral is there because this is vein, artery, and
Yes.
nerve, right? And this is the, yes, medial side, pubis.
This is the bone of
Yeah.
the.
All
Oh,
right.
okay.
Okay. Moving onwards. Right. If you can identify what kind of image is this or when this investigation is asked for.
It is femoral um, vasculogram.
All right. In which conditions would you ask for
Fem
this? It's what?
in case of
Yes.
arterial injury.
All right. At what level? Would you be able to identify what you're looking at right now? What is
Uh,
A?
A is it is femoral artery.
All right. And what is B and C and D? If you can identify.
Okay. It also could be the popliteal يعني
Yes, it
it
is.
may be
It is. It's lower
it may
below
be a popliteal
popliteal vessel artery.
yes,
So
yes,
if this
yes,
is
this is the popliteal
popliteal,
artery number A.
yes, yes. Then what is
Number B
D
is
and
the
C?
anterior tibial artery.
Okay. Moving on to the right-hand side image.
Number B is the anterior.
What is number 2? Please, if you can identify number 2.
Okay.
This is femoral.
Number 2 is external iliac.
Is it?
No, no. Number two is the common femoral.
Okay. Then,
Sorry.
yes. All right. This is number one is catheter. Number two, you're introducing it into which vessel?
I don't.
Okay. Number three and four, what could that be? 3, 4, 5, 6, and 7. So what are we looking at actually? Has he got disconnected? I think so. All right, thank
You
you.
hear me now?
Yes, now I can hear you.
Okay, there was a problem in the connection.
Yes, in the voice. I thought you got disconnected.
Okay, let's continue.
Yes, please. Can you identify? Or we can come back to that later.
Okay, I will come to this later.
All right, okay, thank you. That